Hey everyone, and welcome back for another deep dive.
Oh,
We're going to be exploring some pretty intense stuff today:
okay.
head, neck, and respiratory disorders.
Yeah.
And we're using a nursing student's study guide as our main source,
Cool.
which I think gives us kind of a unique perspective on how these conditions are treated.
Yeah.
Ever wonder what really happens when those lungs aren't working as they should?
Hmm.
We'll get ready to find out.
It's such a fascinating area of medicine,
Right.
and understanding just how complex the respiratory system is can be really
Yeah.
empowering,
Mhm.
especially when it comes to, recognizing potential problems early on.
Totally. That's what I love about these deep dives. It's like we're
Okay.
getting a crash course in healthcare.
Uh-huh.
Okay, let's jump right in. Starting with head and neck cancer.
Okay.
This study guy hit me with a statistic that was pretty sobering.
Really?
85% of these cancers are caused by tobacco use.
Wow.
That's both smoking, AD, chewing tobacco.
Yeah, it really underscores the importance of education and prevention efforts when it comes to tobacco.
For sure.
And what's also interesting is that we're seeing a rising link to HPV,
Oh, really?
specifically in younger patients,
Wow.
which has really shifted the focus of preventative care in recent years.
That's a game changer. So, what kind of signs should people be looking out for? I mean, besides the obvious, of course.
Right.
What are those subtle clues that something might be wrong?
Well, you want to pay attention to anything unusual in your mouth or throat
Mm-hmm.
that doesn't seem to go away.
Mm-hmm.
Red or white patches,
Uh-huh.
sores that won't heal,
Got it.
persistent pain or swelling. Those are all red flags.
Okay.
Difficulty swallowing is another big one.
Okay.
Unfortunately, these cancers often don't cause noticeable symptoms until they're more advanced,
Oh.
which is why that early detection is so crucial.
So let's say someone IS diagnosed. What
Okay.
happens next? What are the main treatment options?
Well, surgery is often that first line of defense, aiming to remove as much of the cancerous tissue as possible.
Yeah.
Radiation and chemotherapy can also play a role, either alone
Mm-hmm.
or in combination with surgery.
Makes sense.
But it doesn't end there.
Oh.
The post-surgical care can be really challenging,
Oh, wow.
especially for patients who are dealing with things like
Yeah.
difficulty swallowing as they recover.
The study guide actually highlights the vital role of nursing care in these situations.
Oh, that's interesting.
Yeah.
Absolutely. Nurses are essential
Yeah.
in helping patients adapt to these challenges.
Right.
They work closely with patients to ensure they can eat safely,
Mm-hmm.
manage their pain effectively,
Okay.
and provide really crucial emotional support throughout that whole recovery process.
It's a lot.
Imagine having to relearn how to swallow.
Yeah.
I mean, that's where nurses really shine.
Okay, deep breath in, everyone, because we're about to enter the world of chest trauma.
Here we go.
This section of the study guide felt like a medical thriller full of suspense and unexpected twists. It really emphasizes that with blunt force trauma, the internal damage can be far worse
Wow.
than what you see on the outside.
Oh, really?
We're talking impacts,
Okay.
crushing injuries.
Right.
Things can get pretty intense.
Yeah. And the guide uses the example of flail chest
Okay.
to really drive that point home.
Okay.
It's a condition where several ribs are broken in multiple places,
Oh, wow.
causing a section of the rib cage to actually detach
What?
and move paradoxically during breathing.
So as you inhale and the chest expands,
Yeah.
that detached section actually moves inward.
Exactly.
Oh, wow. Flail chest. That's definitely not something you want to Google image search.
Right.
And then there's tension pneumothorax, which sounds equally terrifying.
Tension pneumothorax is a life-threatening situation
Okay.
where air becomes trapped in the pleural space,
Okay.
which is the area between the lung and the chest wall.
Got it.
This trapped air can't escape,
Oh, no.
and the pressure builds up, compressing the lung and even pushing the heart over to one side.
Okay.
Think of it like a one-way valve.
Hmm.
Air can get in, but can't get out.
So it's like your chest cavity becomes a pressure cooker.
Exactly.
No wonder it's considered a medical emergency.
And that's where chest tubes come in. They're the heroes of this story.
Ah, yes. Chest tubes. Not just for wine anymore.
Huh.
I'm sensing a bit of humor in this study guide, which I appreciate.
That's good.
But seriously, what exactly are chest tubes and how do they work?
Well, chest tubes are basically hollow tubes
Okay.
inserted into the chest cavity
Mm-hmm.
to release that trapped air or fluid and allow the lung to re-expand.
So it's like a release valve?
Kind of.
Okay.
There are different types of chest tubes and drainage systems,
Got it.
and one of the key things healthcare professionals look for is something called tidling.
Tidling.
Yeah. This refers to the fluctuation of fluid levels in the tube.
Okay.
That corresponds to the patient's breathing.
Interesting.
It's a visual indication that the system is working.
Oh, wow.
And the lung is expanding properly.
Titling. That's fascinating. It's like a little window into what's happening inside the chest.
Right.
The study guide really emphasizes the importance of nurses in managing chest tubes
Uh-huh.
and watching for potential complications.
Nurses play a crucial role in the entire process,
Yeah.
from assisting with the insertion and removal of the tubes
Good.
to meticulously monitoring the drainage
Right.
and ensuring the system functions correctly.
Yeah.
They're constantly assessing the patient's comfort and breathing,
Uh-huh.
making sure things are progressing as they should.
All right, before we move on to the next section,
Okay.
I want to pause for a moment and ask you, the listener, what's standing out to you so far?
Good question.
Anything surprising? Anything that makes you want to learn more?
What I find most fascinating is just how interconnected all these systems are.
Right.
So you're talking about the head and neck,
Uh-huh.
the chest,
Yeah.
the lungs,
Right.
the heart.
Oh.
Damage or dysfunction in one area can have this ripple effect on everything else.
Wow.
It really highlights the complexity of the human body.
That's a great point. It's all connected. Well, on that note, let's dive into a plethora of pleural problems.
Right.
What exactly is the pleura, and what can go wrong with it?
Well, the pleura is this thin, delicate membrane
Okay.
that lines the lungs and the inside of the chest cavity.
Huh.
Think of it like a double-layered sac
Okay.
with a tiny bit of fluid in between
Got it.
to allow for smooth movement as you breathe.
Right.
Now, when this membrane gets irritated or inflamed,
Yeah.
it can cause a variety of problems.
Sure.
One of the most common is pleural effusion,
Pleural effusion.
where fluid builds up in the pleural space.
Okay, so we've got fluid building up around the lungs. That doesn't sound good.
Well, it can range from mild to serious,
Okay.
depending on the cause
Right.
and how much fluid accumulates.
Right.
The fluid itself can be either transidate, which is basically just water leaking out due to pressure changes,
Okay.
or exudate,
Exudate.
which is a thicker fluid
Mm-hmm.
that often indicates inflammation or infection.
And if that fluid gets infected, we're talking about empyema, right?
Yes, empyema is a serious complication
Okay.
where the pleural fluid becomes infected,
Oh.
often requiring more invasive procedures to drain and treat the infection.
Definitely not a pretty picture. And then there's pleurisy, which I've heard can be excruciatingly painful.
Pleurisy is an inflammation of the pleural membrane itself,
Okay.
and its hallmark symptom is this sharp, stabbing chest pain,
Yeah.
especially with deep breaths.
Oh, man.
Imagine someone sticking a knife in your side with every inhale.
Ouch. So what can be done about all these pleural problems?
Well-
It sounds like a lot of discomfort and potential complications.
Treatment really depends on the specific condition and the underlying cause.
Okay.
With pleural effusion, sometimes we need to drain the fluid
Yeah.
with a procedure called thoracentesis,
Thoracentesis.
using a needle to remove the excess fluid.
Okay.
For pleurisy,
Mm-hmm.
the focus is on treating the underlying cause
Right.
and managing pain effectively.
Got it.
And then there's atelectasis,
Atelectasis.
which is a fancy term for a collapsed lung.
Wait, collapsed lung. That sounds pretty serious.
It can be, but it's often a complication of other conditions,
Okay.
like surgery or prolonged bed rest.
Oh,
It's like the alveoli,
Alveoli.
those tiny air sacs in the lungs
Yeah.
where gas exchange happens.
Right.
They collapse and you lose lung volume.
Wow.
The study guide highlights the importance of using an incentive spirometer to prevent this.
Incentive spirometer.
It's a simple device that encourages patients to take deep breaths,
Oh,
hoping to reinflate those collapsed alveoli.
so it's like a little exercise for your lungs.
In a way,
Okay, got it. Incentive spirometer check. Now let's move on to some conditions that sound a little more intimidating.
okay.
Interstitial lung diseases.
Oh, yeah.
What are we dealing with here?
Interstitial lung diseases are a group of disorders that affect the interstitium,
The interstitium.
which is the delicate tissue
Okay.
that surrounds and supports the alveoli.
Right.
These diseases cause scarring and stiffening of the lungs,
No.
making it progressively harder to breathe.
So your lungs basically lose their elasticity.
Exactly.
Okay.
The study guide focuses on two specific examples.
Okay.
Idiopathic pulmonary fibrosis,
Idiopathic pulmonary fibrosis.
which unfortunately has no known cause or cure,
Wow.
and sarcoidosis,
Arcoidosis.
which involves the formation of granulomas,
Granuloma.
little clumps of inflammatory cells
Okay.
in the lungs and sometimes other organs.
So these are chronic progressive conditions with no easy answers.
Unfortunately, yes.
That's heavy stuff, folks, but we're just getting started. After a quick word from our sponsors, we'll be back to explore even more respiratory conditions,
Sounds good.
including pulmonary edema. Pulmonary embolism
All right.
and the mysterious cor pulmonale stick with us. And we're back, diving deeper into the world of respiratory disorders.
Back at it.
Learning about all these conditions really makes me appreciate how incredible our bodies are,
Right.
even when things aren't working perfectly.
It truly is remarkable how resilient the human body is.
Yeah.
And the more we understand about how it works,
Uh-huh.
the better equipped we are
Yeah,
to recognize when something is amiss
totally.
and seek appropriate care.
Speaking of things going amiss, let's talk about pulmonary edema.
Oh, yeah?
The study guide describes it as drowning on dry land,
Oh, wow.
which is a pretty vivid and unsettling image.
It is a powerful image and sadly an accurate one for many patients.
Yeah.
Pulmonary edema occurs when fluid builds up in the lungs,
Okay.
making it incredibly difficult to breathe. It's like trying to inhale water instead of air.
So what causes this fluid buildup? Is it always related to a problem in the lungs themselves?
Not necessarily. The most
Mhm.
common culprit is actually left-sided heart failure,
Oh, really?
when the heart's not pumping efficiently.
Yeah.
Blood backs up into the lungs,
Uh-huh.
and that increased pressure forces fluid out of the blood vessels
Okay.
and into the alveoli,
Right.
those tiny air sacs responsible for gas exchange.
Got it.
It's like a traffic jam in the circulatory system,
Okay.
with the lungs bearing the brunt of the congestion.
So it's another example of how interconnected our heart and lungs are.
Absolutely.
What are the warning signs of pulmonary edema? What should people be on the lookout for?
The symptoms are usually pretty alarming. Extreme shortness of breath,
Okay.
a feeling of panic or anxiety,
Got it.
and coughing up frothy, pink-tinged sputum are all classic signs.
Oh, wow.
It's a medical emergency that requires prompt attention.
Yikes, that sounds incredibly scary. I'm guessing treatment focuses on getting that fluid out of the lungs ASAP.
Absolutely. The immediate priority is to support breathing,
Okay.
often with supplemental oxygen
Uh-huh.
or even mechanical ventilation if necessary,
Right.
and of course addressing the underlying cause. Whether it's heart failure or another condition is essential to long-term management.
Let's hope we never experience that. Okay, moving on to another condition that sounds pretty frightening.
Okay.
Pulmonary embolism.
Oh, yes.
The study guide mentions that it's often linked to deep vein thrombosis, DVT, which is a blood clot in the legs. So are we talking about a traveling blood clot situation?
You got it. A pulmonary embolism, or PE,
PE.
occurs when a blood clot, often originating in the deep veins of the legs,
Okay.
breaks free and travels through the bloodstream to the lungs.
Wow.
This clot can then lodge in a pulmonary artery,
Uh-huh.
blocking blood flow to a portion of the lung tissue.
So it's like a double whammy. First you have a clot in your leg,
Right.
and then it travels to the lungs and wreaks havoc.
Exactly.
That sounds terrifying, and a bit like a medical mystery,
Yeah.
since the initial clot might not even be causing noticeable symptoms.
It can be very tricky to diagnose,
Right.
as the symptoms can mimic other conditions like a heart attack or pneumonia.
Oh,
But one of the tests the study guide highlights
yeah.
is the D-dimer test,
D-dimer.
which measures a substance released into the blood
Okay.
when a clot is breaking down.
So when it's like dissolving.
Right. It's not a definitive test,
Okay.
but it can help raise suspicion
Uh-huh.
and guide further investigation.
So the D-dimer is like a clue that something might be fishy.
Exactly.
And if a PE is suspected, what's the gold standard for diagnosis?
A spiral CT scan
Spiral CT.
is the most accurate way to visualize the pulmonary arteries
Okay.
and confirm the presence of a clot.
Got it.
It's a specialized type of CT scan
Yeah.
that creates detailed three-dimensional images of the lungs.
Wow, that's amazing.
Yeah.
Okay, so early detection is crucial. But what about prevention? Are there things people can do to lower their risk of developing these clots in the first place?
Prevention is huge EE,
Okay.
especially for people at risk for DVT,
Right.
like those who are immobile for long periods,
Oh.
have recent surgery,
Okay.
or have certain clotting disorders.
Mm-hmm.
Staying active,
Yeah.
maintaining a healthy weight,
Uh-huh.
and wearing compression stockings, if recommended by a doctor,
Okay.
can all help improve blood flow and reduce the risk of clot formation.
So it's all about keeping that blood moving.
Exactly.
And what about if someone does develop a PE? What are the treatment options?
Anticoagulants, also known as blood thinners,
Oh,
are the mainstay of treatment.
okay.
They help prevent the clot from getting bigger
Right.
and give the body a chance to break it down naturally.
So your body can kind of heal itself.
In a way, in some cases, a filter might be implanted in a large vein
Oh, really?
to catch any clots before they reach the lungs.
Wow, so it's like a safety net.
Kinda. This is usually reserved for patients who can't take blood thinners,
Okay.
and in very severe cases where the clot is large and life-threatening,
Yeah.
a procedure called a pulmonary embolectomy might be necessary,
Pulmonary
and
embolectomy.
surgically remove the clot.
Wow. It's amazing what medical science can do these days.
Hmm.
Okay, next up we have pulmonary hypertension and cor pulmonale.
Okay.
Those sound a bit like a dynamic duo or maybe a tag team of trouble.
They are indeed closely linked.
Okay.
Pulmonary hypertension refers to high blood pressure
Mm-hmm.
in the arteries of the lungs.
Got it.
This can be caused by a variety of factors,
Okay.
including underlying lung diseases,
Right.
heart problems, or even certain medications.
Interesting.
And as you might imagine,
Yeah.
constantly elevated pressure in the pulmonary arteries can put a lot of strain on the heart,
Makes sense.
specifically the right ventricle,
Right ventricle.
which is responsible for pumping blood to the lungs.
So the right ventricle is working overtime,
Exactly.
trying to push blood through those constricted arteries in the lungs. What happens over time?
That chronic strain on the right ventricle can lead to cor pulmonale,
Cor pulmonar.
a condition where the right side of the heart weakens
Oh.
and eventually fails.
So it's like a vicious cycle. Pulmonary hypertension puts stress on the heart,
Right.
leading to cor pulmonale,
Uh-huh.
which can then worsen the pulmonary hypertension.
Exactly.
It's like a domino effect of dysfunction.
It really is.
The study guide mentions a connection to COPD,
Okay.
which is chronic obstructive pulmonary disease. How does that fit into this picture?
COPD is actually a common cause of pulmonary hypertension.
Oh, really?
When the airways are chronically inflamed and narrowed,
Uh-huh.
as they are in COPD,
Yeah.
it creates resistance to blood flow in the lungs.
Right.
The heart has to work harder and harder
Mm-hmm.
to pump blood through those narrowed vessels,
Yeah.
and over time, this can lead to right-sided heart failure or cor pulmonale.
Wow. It's amazing how one problem can trigger a cascade of effects throughout the body. Okay, let's shift gears and talk about respiratory failure.
Right.
It sounds pretty self-explanatory. The lungs fail to do their job right.
Yes, but it's a bit more nuanced than that.
Okay.
Respiratory failure is essentially a condition where the lungs can't provide enough oxygen to the body
Okay.
or remove enough carbon dioxide.
Got it.
It's important to remember that it's a symptom, not a disease in itself,
Right.
and it can be caused by a wide range of conditions,
Oh.
from pneumonia and lung injury to drug overdose
Wow.
and neuromuscular disorders.
And I noticed that the study guide distinguishes between hypoxemic and hypercapnic respiratory failure. What's the difference?
Hypoxemic respiratory failure
Hypoxemic.
means that there's not enough oxygen in the blood.
Okay.
Hypercapnic respiratory failure
Hypercap.
means there's too much carbon dioxide.
Got it.
Both are serious and require immediate medical attention.
So basically, if the lungs aren't doing their job of gas exchange properly, either too little oxygen is getting in or too much carbon dioxide is building up.
Exactly.
Okay.
And one of the most important things to remember
Yeah.
is that changes in mental status, like confusion, disorientation, or
Okay.
lethargy, can be an early sign of respiratory failure. It's a red flag that something is seriously wrong.
Wow. That's really important to know. So if someone starts acting strangely,
Yeah.
it could be a sign of a serious breathing problem,
Right.
not just a mental health issue.
It's definitely something to consider,
Okay.
especially if they're also experiencing shortness of breath,
Yeah.
rapid heart rate,
Yeah.
bluish skin coloration,
Okay.
or excessive sweating.
Got it.
Those are all signs that the body is struggling to get enough oxygen.
This is all such crucial information. I feel like we're getting a crash course in recognizing medical emergencies.
Knowledge is power, and in this case, it could potentially be life-saving.
Yeah.
The more we understand about these conditions,
Right.
the better prepared we are to act quickly
Mm-hmm.
and seek help when needed.
All right. Are you ready for the grand finale?
Bring it on.
Let's talk about ARDS, acute respiratory distress syndrome.
Oh, yeah.
It sounds pretty intense even compared to everything else we've discussed today.
ARDS is definitely one of the most serious and challenging respiratory conditions out there.
Okay.
It's essentially a form of severe acute respiratory failure
Okay.
that causes widespread inflammation and fluid buildup in the lungs,
Oh, wow.
leading to life-threatening difficulty breathing.
So it's like pulmonary edema on steroids. But what triggers this extreme reaction in the lungs?
A variety of insults can trigger ARDS,
Okay.
from severe infections like sepsis and pneumonia
Right?
to direct lung injury from trauma,
Mm-hmm.
aspiration,
Okay.
or inhalation of toxic substances.
Got it.
Even things like pancreatitis or a massive blood transfusion
Wow.
can lead to ARDS.
Wow. So it's not just a lung-specific problem, but a systemic response to a major insult to the body.
Exactly.
That's incredible. How does ARDS actually develop? What's happening in the lungs?
The study guide breaks it down into 3 phases.
3 phases.
The first phase, called the exudative phase, is characterized by widespread inflammation
Okay.
and increased permeability of the blood vessels in the lungs.
So the blood vessels are basically leaking.
In a way, this means the fluid leaks out of the blood vessels and into the air sacs,
Right.
making it extremely difficult to get oxygen into the bloodstream.
So it's like the lungs are springing leaks everywhere. That sounds incredibly dangerous.
Right.
What happens next?
The second phase, called the proliferative phase,
Oh, worked it.
is where the body tries to repair the damage.
Okay.
However, this repair process often leads to the formation of scar tissue,
Scar tissue.
which can further stiffen the lungs
Oh, no.
and impair their ability to expand properly.
And then there's a third phase, right? The guide mentioned something about a fibrotic phase.
Yes, the fibrotic phase, also called the late phase, is the most concerning.
Okay.
Not everyone with ARDS progresses to this stage,
Right.
but for those who do,
Yeah.
it's marked by extensive scarring and irreversible lung damage.
Oh, wow.
Recovery from this phase is incredibly challenging,
Yeah.
and unfortunately, many patients don't survive.
That's incredibly heavy stuff. It makes you realize just how fragile the respiratory system can be
It does.
and how quickly things can go downhill.
Certainly. But even in the face of such a serious condition, there's hope.
Oh, that's good.
Advances in critical care medicine have improved outcomes for ARDS patients.
That's great.
And ongoing research is exploring new treatment options
Okay.
and ways to prevent this devastating condition.
Speaking of serious conditions that have shaken the world, we can't wrap up this respiratory roller coaster without at least mentioning COVID-19.
Right. The guide briefly touches on the key symptoms of COVID-19,
Yeah.
which I'm sure we're all too familiar with by now.
Unfortunately.
Fever, cough, shortness of breath, fatigue, loss of taste or smell.
Right.
The list goes on. It also emphasizes the importance of prevention
Yes.
through vaccination, masking, and social distancing,
Yeah.
as well as the various treatment protocols available depending on the severity of the illness.
Well, that was quite a whirlwind tour of respiratory disorders.
Ew.
I'm feeling a bit overwhelmed by all the information,
Yeah,
but also incredibly grateful for the knowledge we've gained.
me too.
I know I've learned a ton.
Absolutely.
Yeah.
So as we wrap up part 2 of this deep dive,
Yeah.
what are some of the key takeaways you want our listeners to remember?
That's a good question.
What's the most important message you want to leave them with?
It is a good question.
Yeah.
What are some of the key takeaways you hope our listener is walking away with? What are the big aha moments from all this?
Well, I think first and foremost, prevention is key.
Yeah.
We've talked about a lot of serious conditions today.
Right.
And while not all of them are preventable,
Yeah.
many are things like not smoking,
Mm-hmm.
getting vaccinated,
Right.
staying active,
Yeah,
and maintaining a healthy weight can go a long way in protecting your lungs.
for sure.
It sounds simple, but those basic healthy habits
Yeah.
really make a difference.
It's like building a strong foundation for your respiratory health, right? And then on top of that, we have early detection,
Yes.
paying attention to your body, noticing any changes, and seeking medical attention promptly
Right.
can make all the difference in outcomes.
Couldn't agree more. We've seen time and again just how important it is
Yeah.
to recognize those signs and symptoms of respiratory distress
Right.
and get help quickly.
Yeah.
Sometimes those early symptoms are subtle.
Oh, yeah.
So it's really about tuning into your body
For sure.
and not ignoring those warning signs.
And it's been striking how interconnected our bodies are. What starts as a respiratory problem can quickly affect other systems.
Yeah,
Particularly the heart,
absolutely.
like a domino effect.
That's a crucial point. It highlights the importance of a holistic approach to healthcare.
Yeah.
We can't treat the lungs in isolation.
Right.
We need to consider the whole person
Totally.
and all the factors that might be contributing to their condition.
This nursing student study guide has been such a fascinating resource, giving us a glimpse into the world of respiratory care.
Yeah.
Any final thoughts on that? It seems like nurses are the unsung heroes in a lot of these situations.
Absolutely. They're on the front lines,
Yeah.
providing compassionate care and advocating for their patients.
Yeah.
They're the ones who are constantly monitoring, checking for changes, making sure the patient is as comfortable as possible.
Right.
Their role is truly invaluable.
Here. Well, folks, we've reached the end of our deep dive into head, neck, and respiratory disorders.
Wow.
I hope you found it as informative and engaging as we did.
Me too.
I know I've learned a ton.
Me too. And I hope it sparked a curiosity in you
Yeah.
to learn even more about this vital system that
Uh,
keeps us breathing. There's
yes.
so much more to discover beyond what we've covered today.
Absolutely. We've only just scratched the surface.
Right.
Now for a final thought-provoking question to leave you with.
Okay.
If you were a healthcare professional facing these challenges every day,
Hmm.
what aspect of respiratory care would you find most demanding?
Wow.
And what would you find most rewarding? Something to ponder as you continue your own exploration of this fascinating topic. Until next time, keep breathing, keep learning, and keep diving deep.